UroPatient. Tune in and see, empowering your health for you and me, you and me. Knowledge is power, we make it clear every Saturday morning. The podcast is here.
Hey, good morning and welcome to the UroPatient podcast. I'm your host, Vic Senese. Be sure to like and subscribe. So this week we're going to be talking about, you got that abnormal test, but do you really need a prostate biopsy? So we're going to discuss what that MRI means, what options there are. So last week I explained what to expect during a prostate MRI. This week I'm going to help you understand what your MRI results mean. Your radiology report should include something called a PI-RADS score, which estimates how likely it is that the area of your prostate could contain clinically significant prostate cancer. Now, most MRI findings are not cancer, but some areas may require a prostate biopsy to determine exactly what is present. I'll explain each PI-RADS score, what your doctor is looking for, and what the next steps may be, so you can better understand your results and feel more confident when discussing your care with your healthcare provider. As I mentioned last week, think of your PSA like a warning light on your car's dashboard. When the warning light comes on, it tells you something needs attention, but it doesn't always tell you exactly what's wrong. In the same way, an elevated PSA does not mean you have prostate cancer. Years ago, when a man came in with an elevated PSA, he was often sent directly for a prostate biopsy. It was 4.0, do not pass go, do not collect $200, you're getting a biopsy. Today, we take a more personalized approach. Before recommending a biopsy, or even sometimes before ordering a prostate MRI, your healthcare provider may consider additional factors such as repeat the blood test, the PSA test, measuring the free PSA percentage, using blood or urine biomarker tests like the 4K score or the ExoDx, looking at your family history, performing a digital rectal exam, and evaluating your age and prostate size for overall risk. As mentioned last week, those numbers were abnormal enough that an MRI was performed. Now let's discuss those results. PI-RADS stands for Prostate Imaging Reporting and Data System. It's a standardized scoring system that radiologists use to describe findings on a prostate MRI and estimate the likelihood that an area contains clinically significant prostate cancer. The score ranges from 1 to 5. A PI-RADS score is not a cancer diagnosis. It's a tool that helps your healthcare provider decide whether additional testing, such as a prostate biopsy, might be appropriate. A PI-RAD 1 or PI-RAD 2 result is generally reassuring. PI-RAD 1 means the MRI appears completely normal, and clinically significant prostate cancer is highly unlikely. PI-RAD 2 indicates the MRI shows changes that are very likely due to benign or non-cancerous conditions such as an enlarged prostate or inflammation, and clinically significant prostate cancer is still unlikely. In most cases, these results do not lead to a biopsy. Instead, your healthcare provider will consider a PSA level, physical exam, family history, and other risk factors to determine whether routine monitoring or additional testing is the next best step. Now, PI-RAD 3, that's this result. It's considered an indeterminate finding, meaning the MRI shows an area that is not clearly benign, but is not strongly suspicious for clinically significant prostate cancer. In other words, it's a gray zone. Some men with a PI-RAD 3 lesion have cancer, while many do not. The decision to perform a prostate biopsy depends on additional factors, such as your PSA level, PSA density, age, family history, digital rectal exam findings, previous biopsy results, and other risk factors. Your healthcare provider will use all of this information, not just the MRI score, to recommend the most appropriate next step. Now, PI-RAD 4 or PI-RAD 5. Those results mean the MRI has identified an area that is suspicious for clinically significant prostate cancer. Doesn't mean you have it. PI-RADS-4 indicates that the clinically significant cancer is likely, while PI-RADS-5 means it's highly likely. Although these scores increase the concern for cancer, they do not confirm a diagnosis. That's important. A prostate biopsy is usually recommended to determine whether cancer is present, and if so, how aggressive it is. The MRI helps your urologist target the suspicious area during the biopsy, improving the chances of finding clinically significant cancer while reducing the detection of cancers that may never require treatment. Another important piece of information you'll receive from your prostate MRI is the size or volume of your prostate. Your healthcare provider can divide your PSA level by your prostate volume to calculate a value called PSA density. This number helps determine whether your PSA is higher than expected for the size of your prostate. For example, a large prostate often produces more PSA, even when no cancer is present. Remember, PSA belongs there. It's supposed to be there, it's just in low levels. In contrast, a high PSA coming from a relatively small prostate may be more concerning. Now, PSA density is that calculation by dividing your PSA level by the volume of your prostate. In general, a PSA density below 0.10 is considered low risk and is reassuring. Now, a value between 0.1 and 0.15 is considered intermediate risk and is interpreted along with your MRI findings and other risk factors. However, a PSA density greater than 0.15 is associated with a higher likelihood of clinically significant prostate cancer and may increase the recommendation for a prostate biopsy, especially if your MRI shows a suspicious lesion. Now that brings us to the decision matrix. So your prostate cancer risk, the decision matrix brings your prostate cancer risk into better focus by combining two important pieces of information from your evaluation: your PI-RADS score from the MRI and your PSA density. So we can see that if you have a low PI-RADS score, low density, safe to monitor, no biopsy needed. However, high PI-RADS score, even with a low density, biopsy probably recommended. High density, but a normal or low MRI PI-RADS score, you need to talk about it. It's kind of that gray area. That's why it's gray. And up here, you have a high PI-RADS score, a high percentage on your density, strongly recommended. Okay, so the decision matrix brings your prostate cancer risk into better focus by combining two important pieces of information from your evaluation: your PI-RADS score from your prostate MRI and your PSA density. So we can see over here, I'm blocking it. Try to see how I can get out of this. There we go. So you can see from here that if you have a low PSA density and a low PI-RADS score, it's safe to monitor. However, high PI-RADS score, even with a low density, biopsy probably recommended. So we've reached the point where a prostate biopsy is highly recommended, but there's still some important questions to ask before moving forward. One of the most important decisions is which type of biopsy is best for you. In the old days, we did a systematic guess, taking samples from 12 areas using ultrasound guidance. I say guess because we did do 12 areas that were pretty much, a pattern that we did, 6 on each side, front to back. But today there are different approaches, including transrectal biopsy and transperineal biopsy with fusion of those MRI images for a targeted approach. So we know that there was a lesion found, you want to nail that lesion. Now, next week I'll discuss the different approaches to prostate biopsy, including transrectal biopsy versus transperineal biopsy. I'll explain how each procedure is performed, the advantages and disadvantages of each method, differences in infection risk, accuracy, and your experience, and why your healthcare provider may recommend one approach over the other. Or maybe you've got a choice. Understanding your options can help you have a more informed conversation with your urologist and make the decision that is right for you. You won't want to miss next week's episode.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, paving your health for you and me. Knowledge is power, we make it clear. Every Saturday morning, the podcast is here.